Welcome, everyone. Today we embark on a journey throughout history, exploring the shadows that linger, casting their dark influences on the present. I will dive into a topic that's rooted in silence, yet vital for understanding the contemporary struggles faced by Black mothers in healthcare, the interplay of historical sexualization in slavery, and its enduring impacts on Black maternal healthcare disparities. First, we must start with the social attitudes of Black women during enslavement period. The social attitude towards Black women during the enslavement period were deeply entrenched in the dehumanizing and exploitative systems of slavery. Black women were considered property, subject to the dual oppression of race and gender, and overall denied basic human rights. Here are some key aspects of social attitudes towards Black women at the time. Firstly, Black women were viewed as commodities, valuable property for their labor and reproductive capabilities. They were bought, sold, and traded like livestock with little regard for their autonomy or humanity. Additionally, enslaved Black women were stripped of their dignity and personhood, reduced to mere property in the eyes of their oppressor. They were denied the rights to family integration, often separated from their children and loved ones, as treated as disposable labor units. Additionally, Black women were expected to perform grueling physical labor in the fields, as well as domestic work within the slave owner's household. Their contributions were undervalued and exploited, with little to no compensation or recognition. And lastly, stereotypes portraying Black women as hypersexual, promiscuous, and inherently inferior were perpetuated to justify their mistreatment and subjugation. These harmful stereotypes continue to have repercussions in contemporary society. During the enslavement period in the United States, the reproductive rights and fertility of Black women were systemically violated and controlled by slave owners in the institution of slavery itself. Here's an overview of Black fertility during that time and the disturbing practices of forced sterilization. Slave owners often viewed enslaved women primarily as sources of labor and a means to increase their wealth through the reproduction of enslaved children. Enslaved women were frequently subjected to forced reproduction, with slave owners actively encouraging or even mandating pregnancies to increase the enslaved population on their plantations. The result of this exploitation is that enslaved women were forced to bear children under harsh and inhumane conditions, with little control over their own reproductive choices. The children born into slavery were considered the property of their owners, perpetuating the cycle of intergenerational enslavement. Because enslaved women had no legal rights over their bodies or reproductive health, they were often subjected to sexual violence and exploitation by slave owners and overseers, further undermining their autonomy and agency. I also think it's important to talk about forced sterilization. Even though it wasn't necessarily in the enslavement period and was practiced predominantly in the 20th century, there were still instances of forced sterilization of Black women during and after the enslavement period. In the post-emancipation era, eugenics ideologies gained prominence, and Black women were disproportionately targeted for sterilization without their consent as a part of efforts to control the Black population. Additionally, during this time, enslaved Black women were also subjected to medical experiments without their consents, including procedures that affected their reproductive health. These unethical practices further underscored the disregard for Black women's bodily autonomy and systemic devaluation of their lives. Overall, the forced reproductive and violation of reproductive rights experienced by enslaved Black women during the enslavement period laid the groundwork for later injustices, including forced sterilization campaigns and ongoing disparities in reproductive health care. Understanding this history is crucial for recognizing the enduring legacy of reproductive exploitation and advocating for reproductive justice and autonomy for Black women today. So that brings me to my next point. The Black maternal health care crisis refers to the alarming disparities in maternal health outcomes between Black mothers and their white counterparts in the United States. Despite advances in health care, Black women continue to experience disproportionately high rates of maternal mortality, morbidity, and complications compared to white women. Several factors contribute to this crisis. Firstly, I want to highlight how big the disparity actually is. The Center for Disease Control and Prevention reports that 50,000 women in the United States suffered from pregnancy complications annually, but that Black women are at least 3 times more likely to die due to pregnancy-related causes when compared to white women. That is a crazy statistic. Additionally, an analysis conducted by the state maternal mortality review committees revealed that 80% of maternal deaths happened after the child was born and were preventable. Clark went on to say that every year an additional 60,000 women experience severe maternal morbidity episodes or near-miss life-threatening experience during the prenatal period, and these events disproportionately affect people of color and low-income women. Another study reports that the National Bureau of Economic Research reports that the wealthiest Black women in California is at higher risk of maternal mortality than the least wealthy white women. All of these statistics just show that this crisis is something that we need to deal with. However, the issue at its core is that Black women often face racial biases and discriminations within the healthcare system, leading to disparities in the quality of care they receive. Studies have shown that the healthcare providers may hold implicit biases that result in Black women's symptoms being dismissed or downplayed, delaying necessary treatment. The Black maternal mortality crisis has impacted many Black women, including prominent figures such as Serena Williams, Tori Bowie, and Keisha Knight Pullum in various ways. In 2017, Serena Williams, the renowned tennis champion, shared her own harrowing experience with childbirth complications. Despite her history of blood clots and advocating for herself to be treated for pulmonary embolism, medical professionals initially dismissed her concerns during the birth of her daughter. Williams insisted on further testing, which revealed the severity of her condition. Her experience sheds light on the disparities in maternal health care and the importance of listening to Black women's concerns during childbirth. Additionally, Tori Bowie, an Olympic sprinter, shared her struggles with infertility and the challenge she faced during pregnancies. She highlighted the lack of awareness and support for Black women's reproductive health issues, emphasizing the need for greater access to fertility treatments and maternal health resources. And lastly, actress Keisha Knight Pullum, known for her role as Rudy Huxtable on The Cosby Show, spoke out about her experience with postpartum preeclampsia after giving birth to her daughter. Pullum emphasizes the importance of prioritizing mental health and raising awareness about the risk of postpartum complications, particularly for Black women. I think these examples are really important because it shows that prominent and healthy Black women are still facing these health disparities. However, as these public figures have used their platforms to raise awareness about the Black maternal mortality crisis and advocate for improved healthcare policies and practice, as well as empower other Black women to advocate for their own health and well-being during pregnancy and childbirth, their stories have contributed to greater visibility and understanding of the systemic challenges facing Black women in accessing quality maternal health care, and underscores the urgent need for reform to address racial disparities in maternal health outcomes. Now that we have looked at the facts about the Black maternal health care crisis and various examples, let's link slavery to the Black maternal health care crisis. The link between slavery and the Black maternal health care crisis is deeply rooted in historical, social, and economic factors that have created a complex web of racial bias, discrimination, and systemic injustice. For instance, the legacy of slavery has perpetuated racial bias and discrimination within healthcare systems. Studies have shown that Black women are more likely to experience mistreatment, neglect, and dismissal by healthcare providers compared to the white counterparts. This bias can lead to delay in cares, mixed diagnosis, and inadequate treatment, contributing to poor maternal health outcomes. Additionally, there are myths like the welfare queen and the pain intolerance that also plague Black maternal health. Another link between slavery and the Black maternal health care crisis is the social determinants of health. Black women are disproportionately affected by social determinants of health, such as poverty, lack of access to quality health care, inadequate housing, and food insecurity. All these factors can increase the risk of complication during pregnancy and childbirth. Moreover, the intergenerational trauma also influences Black maternal health. The trauma inflicted upon Black communities through centuries of slavery, segregation, and ongoing racial violence has profound effects on maternal health. Intergenerational trauma can manifest as chronic stress, anxiety, and depression, all which can negatively impact pregnancy outcomes and maternal well-being. Additionally, like I mentioned, Black women have also faced reproductive exploitation and control. Historically, Black women's reproductive rights and autonomy have been disregarded, leading to forced sterilization, coerced contraception, and limited access to reproductive health care services. This history of exploitation and control undermines the trust in the healthcare system and contributes to disparities in maternal health care. And lastly, structural racism and disinvestment in Black communities have resulted in inadequate healthcare infrastructures, limited access to quality prenatal care, and higher rates of medical deserts. This lack of resources exacerbates the maternal healthcare crisis and perpetuates even more disparity in outcomes. Overall, addressing the Black maternal healthcare crisis requires a comprehensive approach that acknowledges and dismantles the systemic barriers rooted in slavery and ongoing inequalities. This includes implementing policies to address racial biases in healthcare, improving access to quality healthcare services, investing in community-based programs, and centering the voices and experience of Black women in healthcare policies and decision-making. Now that I've laid the ground between the links of slavery and Black maternal health care crisis, we must think of solutions to combat this issue. Addressing the Black maternal health care crisis requires a multifaceted approach that encompasses policy change, healthcare reforms, community engagement, and broader societal shifts. Here are some possible solutions that I think might help. Firstly, healthcare providers should undergo mandatory training to recognize and address implicit biases that contribute to disparities in maternal care. This training should emphasize cultural competency, empathy, and awareness of historical injustices. Additionally, policies should be enacted to ensure that all individuals, regardless of race or socioeconomic status, have access to comprehensive prenatal care, including prenatal visit screenings and support services. This may involve expanding Medicare coverage, increasing funding for community health systems, and eliminating barriers to healthcare access. Additionally, we should center community engagement and leadership. Community engagement and leadership are crucial to developing sustainable solutions to Black maternal health care crisis. Black-led organization, grassroots movements, and community stakeholders should be actively involved in shaping policies, programs, and initiatives aimed at improving maternal health outcomes. In conclusion, it is imperative to recognize the profound and enduring impacts of slavery on Black maternal health care crisis. The historical legacy of slavery has contributed to systemic racism, bias, and discriminations within healthcare system, perpetuating disparities in maternal health outcomes for Black women. By acknowledging this link and addressing the root cause of inequality, we as society can work towards building a healthcare system that ensures every individual, regardless of race or background, receives dignified, respectful, and equitable care during pregnancy and childbirth. It is essential to prioritize policy change, healthcare reforms, community engagement, and broader societal shifts to dismantle systemic barriers and achieve reproductive justice for Black women. Only through collective action and commitment to justice can we create a future where every woman has the opportunity to thrive and experience safe and supportive maternal care. Also, here is my citations for my pictures and my citations for my information. Thank you so much, and I hope you learned a lot.